Hello, you're welcome. It gives me great joy to notice you viewing this video and to notice you're visiting this channel. Thank you very much. I am Dr. Olayinka Conley. I am a sociologist. I am a researcher. I am a lecturer in the university. I am a life coach. And I do a lot of things on this channel. But all the things I do on this channel, you can cluster them into 4. Sociology, research, relationship, and migration. All of these I do as frequently, as consistently as possible to add value to my viewers and my subscribers. Today, I want to address a very important topic, which means the title of this video is what is medical sociology and what is the relevance? Meanwhile, if this is your first time of viewing my content, kindly subscribe to this channel. It means a lot. Tell others about this channel. Comment, like, and share this video as widely as possible. If you have subscribed to this channel previously, thank you for staying tuned. Kindly comment, like, and share this video as widely as possible. Then, what is medical sociology and what is the relevance? Let me say right on up front that medical sociology is one of the most important branches of sociology. It is very relevant. It talks about health, and health, they say, is wealth. Medical sociology is that aspect of sociology that tries to understand the relationship between human behavior and health. It answers the question, what is the implication of human behavior for health? When people behave in a certain way, how does this affect their health outcome? How does this affect their health situation? Behavior is very important in determining people's health. Yet we want to understand the role of this behavior, the role of culture, tradition, behavioral patterns of people in their health. Now, so medical sociology is very important because when people talk about health, they think about medicine, they think about pharmacy. Whereas medical sociology is that aspect of sociology that establishes a handshake with medicine. It's actually sociology in medicine. But in medical sociology, it is believed that what you see in medicine in terms of practice is actually a consequence of behavior of people. People don't just fall sick. They don't just use health facilities. It has to do with their behavioral pattern, how they perceive their orientation, their belief system will determine their health situation and their health seeking behavior. Don't you see that medical sociology is very important? So when you're not looking at towards medicine, hospitals, you don't understand why people use certain hospitals and don't use others. You don't understand why some people go to the hospital, why some refuse to go to the hospital. Medical sociologists will tell you why this is so. So it's very, very difficult for you to understand people's health and health behavior without understanding their behavioral pattern. Why do you have some societies, some communities experiencing some health problems? Why others don't? It's not just geography. It's just not just natural. Sometimes you find the answer in health. Then in culture, you find reasons for health situations in culture. You will explain health. You understand health and medicine better when you understand the behavior. Therefore, medical sociology attempts to understand group dynamics, the role of group dynamics, the implications of group dynamics, and how these group dynamics, how people behave in group, how these affect their health situation and health outcome. So medical sociology tries as much as possible to adopt sociological theories, sociological concepts, methodologies of sociology in understanding or in analyzing health. And this is very important because if you use these sociological theories, sociological concepts, sociological methodologies, you are able to understand health very, very well. So we want to understand, in medical sociology, the attempt is to understand health-related behavior. Health-related behavior. Behaviors that relate to health. Behaviors that impact health. and we understand the relationship between behavior and health in the long run. So we always want to understand illness behavior. When people fall sick, how do they behave? When they are healed, how do they behave? And what affects their behavior? And so this enables you to be able to manage patients better. As a matter of fact, medical sociology is heavily recommended for medical practitioners, for doctors, for nurses, and all the affiliated medical courses. Because these patients you are treating, if you don't understand the behavioral pattern, which you can easily find if you understand the culture and the traditions and the environmental and societal processes that medicine may not be able to tell you, then medical sociology will be able to tell you. That's why if you are a medical sociologist, you are also a sociologist in the health sector. In fact, I've seen many researches done that in medicine, that medical sociologists are heavily represented. In fact, for WHO now, it's very important that you have, World Health Organization, it's very important that you have medical sociologists on health-related themes. And the medical sociologists are consultants to many health institutions and even to WHO, because people know that behavior is very important. So illness behavior, sick role behavior, role that people play when they are sick, how you are able to manage people and their kind of sickness is very important. So we also want to understand health of people and their orientation to medicine. Health and medical orientation of people, is very important. We want to understand the interests, the motivations, the attitude of people towards medical system. Like I said earlier, how do you have somebody using the hospital while some don't use? Why do some people use primary health care rather than going to secondary health care or tertiary health care? Why do you have some people prefer to use traditional medical system rather than the modern? You have the debate between orthodox medicine and traditional medicine. I don't want to go into the debate of which one is orthodox, which one is traditional in terms of, is it the modern that is orthodox, but I'm sure you are used to the issue about talking about orthodox medicine and traditional medicine. The debate is that some believe that is this so-called traditional medicine that is actually the orthodox, and some believe otherwise. But I'm sure you are used to the conduct. Let me use more appropriately for my purpose so that you don't get confused why some people use traditional medicine and why some people use Western medicine, Western-oriented medicine. Why would some people rather believe it doesn't matter the level or the nature of the illness, they prefer to still use their traditional medicine, even when there are no scientific proofs that this will work. They simply believe that based on their cultural orientation, traditional they would rather use. And some they don't believe in the traditional. They believe they have to go and use the Western type of medicine, which some people call orthodox, because they believe it's scientific, there are proofs and this and that. So, but what informed this kind of decision is the behavior of people, their socialization process. Meanwhile, I have a video on socialization on this channel. You can watch that. I also have a video on branches and areas of specialization of sociology. I did mention medical sociology there. So it's in the culture of the people, it's in their tradition that they have this interest, motivations, attitude, beliefs, and behavior to do this. So we also want to understand the patterns of utilization of medical facilities. There are different medical facilities around. What determines the patterns we want to understand? We want to understand the curative and the treatment services and the role of human behavior in these preventive and even curative and treatment services. We want to understand how to prevent illnesses, sick behaviors. We want to understand how we can prevent. People say prevention sometimes is better than cure, but diseases can be prevented when we understand human behavior better. Medical sociology will be very relevant in this because it's also about understanding the socio-cultural components of illnesses, diseases, and healthcare. Socio-cultural components of illnesses, diseases, and healthcare. We want to understand how people, when they relate in society, how will this affect the illnesses, how will they affect diseases and healthcare. Remember, during the coronavirus pandemic, suddenly we start talking about the social distance, we start talking about safe distance, we start talking about physical distance, because we believe as people relate, we say don't shake hands, don't hug people. These are relationship issues. And how will this affect people? How will people agree to this? So we want to understand the social components and cultural, the people's culture. What is culture? I have another video on culture on this channel. What is culture? Culture is the total ways of life of a group of people. That is the simple definition of culture. So how the total ways of life of people in a society, how will this affect health, illnesses, diseases, and healthcare utilization? The social and cultural components of illnesses, diseases, and healthcare, these are also things we want to know about in medical sociology. It's about human behaviors, understanding human behaviors, and health outcomes of people. And medical sociology is also interested in the epidemiology. Medical sociologists also do a lot in terms of epidemiology, the spread, the etiology of diseases, even the issue of bioethics. When I talk about bioethics, medical sociologists are the front burner of this, talking about the biology and the value of ethics in society, in terms of anything you do, research, medical practice, the biological and the ethical values of society. How will the ethical values of society, the role of ethics, affect your biological practices or medical practices? And what are the standards you have to follow, ethical standards, ethical considerations you have to follow? Medical sociologists and medical sociology is at the forefront of this. So we talk about social psychiatry. I have a video on this channel on how to have excellent mental illness. Mental illness, that some people, it's a psychiatric system. People want to understand it's an mental illness now, or psychiatric cases now are epidemic across the world. So medical sociologists also want to see how to deploy social understanding, social research, and elements to be able to understand and better manage or even prevent psychiatric cases, or also to be able to better manage and solve the problem. We also want to understand, like I said initially, comparative healthcare delivery system. What are the healthcare delivery system available, and how are people using them? Using comparative perspective, using historical perspective, the evolution of societal development of societies from the time past to now. Can we see patterns? Can we see trends? Can we see causes and consequences? So we can better optimize the utilization of healthcare delivery system. You don't want to be very efficient. You don't want healthcare delivery system that people will not use based on cultural, based on social, based on traditional reasons, misgivings, some profound to the extent that you may invest heavily economically on a healthcare delivery system, and they will not be optimally used, and you don't want to do it. So history and historical and contemporary narratives, talk about sociology of medicine. This is some people prefer to call it sociology of medicine. Also socialization of healthcare practitioners. People have complained about treatment of people by healthcare professionals, doctors, nurses, midwives, their attitudes to patients and other stakeholders. So medical sociology will also be able to socialize these medical practitioners and others and make them more efficient and more people-centered along the line. So that's why you also have now, there's increasing interest in community medicine. So community medicine is area that sociologists, as medical sociologists, also relate. They have handshake in this time with core medical people. So medical sociology is very relevant. If you look at the way I've explained this, you see even conventional medicine or medical doctors can never be efficient without significant role of medical sociologists. So a medical sociologist is a sociologist in medicine. So if you are interested in medicine, but you are now in sociology, medical sociology can give you a pathway into medical practice. And I know a lot of medical sociologists who are doing fantastically well. Some of them are also my mentors. So I'm very happy to make this video to let you see that medical sociology is very relevant in maintaining maximum health, and also in understanding people in terms of their health and health-related behavior. We don't have to be a medical sociologist, if you like. It's a very interesting and very relevant course. And meanwhile, this video is just a part 1. Because of the comprehensiveness of discourse, I'll make a part 2. So I will drop another video on this same medical sociology washout. Kindly subscribe to this channel, comment, like, and share. Until I see you in the next video on this same subject, be your best.